earlier we were doing these video conferences with ministers when all the ministers used to be there simultaneously, and for about 3 hours we used to discuss in the presence of all of us. So last week I changed the strategy a little bit, and I thought that we must have a good quality discussion with each of the ministers, and so that we can appreciate each other's problems and the gaps in greater detail and take care of them. So in the last couple of days I already had discussions with the health ministers of Delhi, Madhya Pradesh, Bihar, Maharashtra, Gujarat, Uttar Pradesh, Odisha, and also West Bengal. West Bengal was represented by a senior officer, but all the places we had our ministers there along with their team, and all the DMs of the red zone districts. National situation today, we have had almost 56,342 cases at the country level, and with 1,886 unfortunate deaths, and already 16,540 people have recovered and gone back home. That's the national situation. The fatality rate today is roughly 3.3%. And just to give you an idea, in the whole country, we have about 821 total dedicated COVID hospitals, where we have already organized some 150,000 hospital beds, ICU plus isolation, and also we have about 1,898 total COVID health centers. There also another 1,19,000 odd beds are there. Apart from this, we have something like 7,607 quarantine centers also in the whole country. And the good news is that already we have tested 14,40,433 individuals at the country level, and our lab count has now gone to 453, which includes 332 labs in the government sector and 121 in the private sector. We have now, at the moment, we have a testing capacity of 95,000 tests in a day. I have to congratulate you and your whole team, starting from Health Secretary to all the DMs and all your health officials. I think you are doing everything very proactively, and I think most of the things that you have said and the good practices that Tamil Nadu has adopted, we also talk about it with other states. Only 2-3 things that we wanted to point out, which we thought maybe you will strengthen the ILI and the SARI thing, and also maybe Arogya Setu app, etc. So you will certainly, and this idea of notifying comorbid and the exclusive COVID deaths separately, this is also a good idea. Maybe we were discussing with the Union Health Secretary to sort of review the overall strategy of the whole country, and maybe if we can think of new guidelines on this issue, that we'll certainly consider that. And this the very fact that you have appointed these new doctors, nurses and sanitary workers, I think that's all welcome moves on your part. I know both of you are very dynamic people sitting there, the Secretary Health and also you and all your team. Just convey our regards to your Honorable Chief Minister, and just request him on our behalf that he should involve all other departments in this fight against COVID, because you alone cannot be. You see, in Government of India, everybody is fighting it together. So there also we want that within the states also all other departments should be thoroughly involved in the fight.